Dr. Jack Wolfson.
Thank you.
Thank you for being here.
Thank you. All right. Let me say this. All disease is from two things. We can make it really, really, really simple for everyone. And it would have been ideal if they would have told me this on the first day of osteopathic medical school. Some of you in the first day of your training, chiropractic school. All disease is from two things. Too much bad stuff and not enough good stuff. That's really what it is. Now, it could be obviously trauma, emotional trauma, physical trauma. That's too much bad stuff. So what we need to do in order to achieve health and wellness is to get more of the good stuff and less of the bad stuff. That's the strategy, more good and less bad. And if we tell our patients, if we tell our clients, if we tell our friends, our family members, and we keep saying it over and over again, get more of the good stuff and less of the bad, and that's how your body will begin to heal. Now, I want to tell you about this man here. This man was the first DO, Doctor of Osteopathic Medicine, at the Cleveland Clinic in 1970. In 1972, he became the first DO at the University of Iowa, a very prestigious cardiology program. 3 years later, he would start up the Chicago College of Osteopathic Medicine, their cardiology department. He would travel all around the world, very well published, well spoken, highly respected. Now, I knew him for all of those things. I knew him because he had a photographic memory. I knew him for all that success. I also knew him because he was my father. He was my father, and I knew him as the life of the party, the joke teller, the storyteller. On Friday afternoons, when work was done, he would take out all of the students, the residents, the cardiology fellows. They'd all go to happy hour and celebrate the end of the week. He was the life of the party. So it shocked all of us, my brother, my sister, my mom, when in his mid-50s, he became depressed. And we said, why is this guy depressed? He's got all the money you could ever want as a very successful cardiologist. All the success, the family, everything. Why is this guy depressed? So like any good family, we take him to a psychiatrist. And the psychiatrist puts him on one drug, another drug, and guess what? They don't work. And we, again, are just floored by the changes in this such a powerful man. He was my hero. And his depression morphed into more of a movement disorder. Problems walking, chewing, swallowing. When he would drink something down or eat, he would cough. He had this blank stare. So we would eventually take him to the neurologist, and the neurologist diagnosed him with Parkinsonism, not classic Parkinson's, but Parkinsonism. Tried him on some pharmaceuticals, they don't work. Finally, we go to the Mayo Clinic. And the Mayo Clinic, they diagnose him with progressive supranuclear palsy, or PSP. PSP. And they say there's no treatment for it. We have no idea what caused it. And he will be dead within 3 years. That's what they tell us. Simultaneously, serendipitously at that time, divinely ordained by God, God introduces me to this woman here. And this woman here is a 29-year-old doctor of chiropractic. And she tells me all the reasons why my father is sick and dying. All the reasons. And she also tells me that me as a cardiologist, my profession is a sham. All of our pharmaceuticals are killing millions of people. Nothing I do is helping anyone. That's what she tells me. And she tells me all the reasons and all the, why my father's sick and dying, tells me all the reasons why my profession is garbage. And that was on the first date. That was on the first date. But I listened to what she had to say for two reasons. Number one, she's smoking hot. Number two, it's because it just made sense. It just made perfect sense what she had to say. And no one ever told us perfect sense. No one told us common sense. When we go through medical school, it is all about pharmaceuticals and surgeries right from day one. And we love that. We soak it all up. The indoctrination system that's been going on for over 100 years since the Rockefellers co-opted health, it is there in full display in medical training. So these are some of the reasons what was going on with my father at the time. He drank this poison called Crystal Light, aspartame, acesulfame, artificial colors. On the top there, you got the Chicago deep dish pizza. We grew up in the north suburbs of Chicago. And all the ethnic food, whether it's MSGs, just a very unhealthy nutrition, upbringing. My father also was a drinker. Like I said, happy hour, weekends. There's no sob story about my father's drinking except for the fact he's dead. That's the sob story. And then bottom left, we've got this very well-known neurotoxin called Lipitor. Lipitor, Crestor, Zocor. He took that poison. Now, he also worked in the most disgusting place in the world, the hospital. Over on the left, you have all of the cleaning agents, the artificial lights, all of the radiation that you see on the right. As a cardiologist, we are standing there at the fluoroscope doing pacemakers and getting blasted with radiation. In fact, when I was dating Dr. Heather, I had her come into the hospital to watch me do a pacemaker. Look how cool I am, I'm doing a pacemaker. And she was actually in the room for 30 seconds, fully gowned up, and then she left. And then after the procedure is over, she said, "That's all radiation destroying your brain. If we're going to be together, you're never going to do that again." I never stepped foot in the lab after that again, after she said that. So again, with all of this food and alcohol and artificial colors and flavorings and really no semblance of a healthy lifestyle, there's someone who's following exactly in the same footsteps as my father. And that is me, circa 2003 at Oktoberfest in Munich, Germany. So if you're going to go off the deep end, that's the place to do it. That's the place to do it. That is before I met Dr. Heather. So when I meet Dr. Heather, she says you need to become a DC. I said, "What are you talking about? I just finished 4 years of osteopathic school, 3 years of internal medicine, 3 years of cardiology training. I'm now a couple years on the job in the biggest group in the state of Arizona, making tons of money." Because it's interesting, because, Dr. Lisa, you and your tribe and everybody, you talk about, how we're going to get more impact into people. We all know we're good. We all know that we're fantastic healers. But how do we get more people to understand that? How do we get more people in the door? My first day On the job as a hospital-based cardiologist, I saw 65 people, day one. And the practice took in all the insurance checks, everything along with it. Money was never a factor. So she says, you need to become a DC. And I said, you want me to become a doctor of chiropractic? And she said, no, not DC doctor of chiropractic. You need to become a DC doctor of cause. And that's what I did. That's what I did. You see, I've worked with some of the top cardiologists in the world, training in Chicago, out in Arizona, and I would rather send any friend or family member to any of you for health and wellness information than any doctor I've ever worked with. What does that say about the system? All right, totally true. All right, so what happens? You know, got to put a ring on that finger, right? You know? My wife will tell you, if you want to change the minds of a medical doctor, ladies, sleep with them, and then they'll come over on your side a lot quicker, okay? So now obviously this is the wedding night. This is May 6th, 2006. Beautiful night in Arizona. Beautiful night in Arizona. The wedding happens, the ceremony happens, and now we're in the cocktail reception. And someone comes running over and says, Grandpa David passed out. So we go running over to Grandpa David. And hey, I'm a cardiologist, right? I've seen so many people pass out, you know, and but again, what do? Check the pulse, see he's breathing. Okay, he's got a pulse, he's breathing. Well, while I'm thinking about this in my head, you know, calling 911, am I going to do? What are we going to do? Dr. Heather is on his cervical spine, in her wedding dress, obviously, in the grass. Knee is down in the grass, and without even a thought, crushes his cervical spine. It was the loudest audible you could ever imagine. I've learned quickly not to say cracking sound, so audible, heard. And with that, Grandpa David opens up his eyes. Shortly thereafter, he's sitting up. And then he's back at the wedding like nothing happened. Now, I used to do tilt table testing in the practice. I've seen a lot of people pass out, vasovagal syncope, neurocardiogenic syncope, the common faint. And here's Grandpa David. He's back at the wedding so quickly when most people, they take, again, hours, days, maybe even up to a week to feel normal again. That is the power of chiropractic. So, kudos to the chiropractors in the audience. So one thing that we said when we got together, and I think it's very important, obviously, as we maybe talk to, you know, the next generation, and say, you talked to your significant other about politics. You talked about religion. Did you talk about how you're going to raise children? Did you talk about all the things that you're going to do? Right? Are you going to, breastfeed? Are you going to co-sleep? Are you going to vaccinate? All these different things. That these things should be discussed, of course, beforehand. Make sure we're all clear there. So when I met Heather and she said, I was never vaccinated, my three siblings were never vaccinated. And if we have children, we're not going to vaccinate them. And I said, okay. I mean, I was a cardiologist, so I wasn't like a card-carrying member of the vaccine club, you know? I was like, yeah, whatever, you know? Like I said, she's smoking hot. I'm like, yeah, chicken pox, it's not that big of a deal. Like, you know, I can get over that one. So we start doing lectures. We start doing lectures at that time. And again, like a lot of you, maybe, you know, there may be 5 people in the audience, 10 people in the audience. But obviously, the more you talk, the more interesting you are, the more on point you are, the more life-changing you are, people start to be attracted. And eventually, the alleged measles outbreak in Disneyland in 2015 happens. And I get a phone call from a friend who's in PR, and she said, Jack, there's NBC Local. They want to talk to someone who is anti-vaccine. So they come into the office, in Arizona. I give my interview, and then it goes live. And then I look in the Arizona Republic, and there is all this just vitriolic, just hate coming in on me for this. And I'd never experienced anything like that before. And ultimately, it leads to a string of events where I wind up on CNN. Within 36 hours, I'm on CNN. And I am railroaded right from the beginning. They have me totally set up to be the fall guy in this one. Little Timmy, he's got cancer, he's on chemotherapy. If he gets measles, he could die. Doc Hollywood there on the left, what say you? Anyone who's anti-vaccine should lose their license. Erin Burnett, she chimes in. I had my kids all vaccinated. I think it's, great, and, so should you. What say you, Dr. Wolfson? So again, I was railroaded right from the beginning. And I said, ultimately, I was able to get this point out. Kids do not need to be injected with chemicals. They need good food. They need a healthy, loving environment, and they need chiropractic care. Now, my wife is in the audience too, and she'll be speaking up next. And it's sometimes I feel like I come across angry when I'm speaking, like angry and like I'm just frustrated by the system. And if you want to see like angry, wait till you see Dr. Heather, because she's this close from turning into the Hulk. She's this close. I say kids need chiropractic care because as I was driving out the door, she said, if you don't mention chiropractic care on CNN, don't come home. I said, well, I want to come home, so I'll squeeze it in there. It's because I, of course, believe it. All right. So, by the way, this little foray led to 38 complaints to the Arizona Medical Board. This led to me hiring Jonathan Emord, paying multiple 5 figures in legal fees. But ultimately, the board took the case. There were 7 people on the board. 6 were DOs. They would have stripped my license instantly, gone, instantly. But the 7th guy, he was an attorney, and he said, you can disagree with Wolfson, and I know why you would. You can agree with Wolfson, but it's Wolfson's freedom of speech, case closed. It's a freedom of speech issue, freedom of speech issue. And really, we are looking for 2 things. We are looking for the freedom of speech to say what we believe. That is absolutely critical, a God-given right. And then number 2, the freedom and autonomy to make decisions for ourselves and for our bodies. So, me personally, there may be things that I disagree that other people do to their children, but I have to go on the freedom line and say it's their right to do so. If they want to, if they want to inject their kids with poison for chicken pox, if they want to inject their newborn baby with hepatitis B, I guess in this crazy world, if I made all the rules, it'd be different. I'm sure you too. A little bit about me again, as Dr. Lisa said, I am a board-certified cardiologist. That was my certificate there up until July of 2024, because a lot of people on social media, they're like, are you even a real doctor? Like they'll say that on my Instagram post. I'm like, how lazy are you? Just Google my name. The Instagram page says natural heart doctor. I wonder who this guy is. I'll just Google him and see what his business is, then read the about page. I was not the crazy cardiologist. he was an awesome cardiologist who met his, with his chiropractic wife, and he went off the deep end. He was a washed-up cardiologist. I was the director of cardiac rehab, chairman of medicine, chairman of cardiology, Phoenix top doc in 2011. Insanely enough, by my peers in 2011, because I was already talking crazy town in 2011, still I got the award for best doc. 2012, I left the big cardiology group. As you can imagine, talking the way that I talk, nobody was upset to see me go. Like they were all like, bye, see ya, never. That's when I started my company, Natural Heart Doctor, Dr. Heather, and 4 beautiful children. And again, wait till you hear Dr. Heather's stories coming up. They're gonna just blow you away. Here is my Amazon best-selling book on the right, The Paleo Cardiologist, The Natural Way to Heart Health. If you are interested, it is available on Amazon. I do have copies outside, so you can buy it from Jeff Bezos, or if you're interested, get it from me. On the left is a textbook of integrative cardiovascular medicine, which is exciting that I was a part of that textbook as well. So there's other MDs, DOs, holistic practitioners, chiropractors in there as well. By the way, and so chapter 14 of my book is called The Wonders of Chiropractic, why everyone in my practice has to be under the care of a chiropractor, or they could get out. They can go see somebody else. Because that's how we're going to be successful in helping people, is with chiropractic care. Now, cardiovascular disease in the 21st century, it is the #1 killer in the world. Millions of heart attacks are happening every year. Millions suffer from AFib, congestive heart failure, high blood pressure, and there's trillions of dollars spent in pharmaceuticals and the procedures. So what are we getting for all that money spent? This is from the CDC. Not my favorite governing body, obviously, but this is right from their website, so using the data from the enemy, if you will. And what we see on this chart is that life expectancy in the last 45 years, since 1980, American life expectancy in the green line, other countries are in the blue line, we've gained 3 years since 1980. All the pharmaceuticals, all the procedures, all the quaxines, all of it, we have 3 additional years. It's embarrassing. When you show people this information, this is what happens when you work with doctors in the medical system. When you work with people like us, that's when you get longevity. That's when people would say, you want to die young at an old age. You want to be the person who's in their mid-80s and you're mountain biking and you're stand-up paddleboarding and kayaking, and you're playing actively with your kids and your grandkids, doing everything you want to do. I really do appreciate the opportunity to be here, because it's so fantastic coming to a meeting or a conference with people who are in the health space, because they're happy. They're just, hugs, kisses, everything, just this mutual love for each other. There's some kind of bond, to all of that. When I see Von Watts, when I see Jabin Moore, when I see Jason Dean and Lisa, and even some of the vendors here who I know, Robert Scott Bell, when I see again, it's like a love fest. You go to a cardiology meeting, everyone's miserable. Everyone's miserable. They feel they're overworked, they're underpaid. It's a totally different vibe. So again, like this tribal mentality of the group all getting together, something special about it. Here's why they think cardiovascular disease, CVD, is so rampant. Number one, they blame it on genetics. They love to blame it on genetics, because if I say it's in your genes, nothing you could do about it, you just got to take the pharmaceutical. Then, of course, people are, oh, well, yeah, that's true. It's true. My father had this, my mom had this, my aunt, my uncle. I am here to tell you, and you already know this, I am here to tell you, in case you don't know this, your genetics are perfect. Everyone in here, your genetics are perfect. You were built in the image of God, or if you got here through evolution, however you believe you got here, that's the subject of another talk by somebody else. Your genetics are perfect. Why would you be genetically programmed to have a heart attack, stroke, cancer, dementia? You're not. You're not. And you all know that as the concept of epigenetics. How everything influences your genes to either make proteins or not make proteins. That's all that's going on over there. That's all that it is. Now, family history is true because you eat, live, and think like your family member did. So my wife said to me, you better change and do things different from your father, otherwise you're going to end up like that or something similar. And when I spoke of the truth about cancer in 2016 and 2017, I said from the stage, you cannot heal in the same environment where you got sick. You have to change up your environment. Now, it doesn't necessarily mean you have to move from Buffalo to Costa Rica. I suggest you do. No insult to Buffalo. I suggest that you do. But the more you change up your environment, your home environment, your food environment, your mindset environment, Dr. Lisa would say your tribe, your network, your group, you change it up and then you plug into something that's different because the one you're in is not working. And that path is not sustainable and it will not be successful. So that is, again, your genetics are perfect. Embrace them. And if we can avoid all the toxins and poisons, as we said, if we get more stuff, if we get more good stuff and less bad stuff, that's all the epigenetic influencers into your genome. They'll tell people, you're just getting older. You're just getting older, you know? I mean, that's why you got high blood pressure. That's why you feel lousy. That's why you've got, why you had a heart attack. You're just getting older. Nothing you can do about getting older, or it's bad luck. Everyone's got it. Everyone's got it. 100 million Americans are labeled with high blood pressure. Do they all have bad genes? Was it such a big mistake that was made in our genetics that 1 out of 3 people? It's laughable. And yet people will fight that tooth and nail online. Okay, or you can say it's a pharmaceutical deficiency, right? It turns out that your heart attack was from a Lipitor deficiency and a deficiency of aspirin. It turns out that you were born without a stent in your left anterior descending coronary artery. And we fixed that. And this is what the bravado, the gall of these medical doctors to sit, most of them believe the lie. They're so confident in the lie, they've got no problem doing it. They really believe that they're helping people. I know because I did. I was born, as I said, I was born into that medical matrix. I'm in my mother's womb. I'm listening to all my father's stories. I was born into that. I would also like to say that if we talk about changing diet and lifestyle, if I could do it as a kid growing up in northern Chicago, and that whole lifestyle, a child of total privilege, father was a very successful cardiologist. If I could make these changes, anybody could. Anybody could. All right. I want to give you guys some take-home points that I'm sure most of you believe to be true. And maybe just, if I'm here for anything, it's to, again, instill the confidence that what you are all doing is right, and what my training, that is wrong. Don't get me wrong, God bless the men and women who work in emergency rooms and trauma centers. I bash the medical system pretty good. Contrary to what Dr. Heather would think, if she God forbid, she got shot, she would go to the chiropractor and be like, okay, pull this out here. That's what she would do. But there's for emergencies and traumas, And she'll say, like, once a medical doctor, always a medical doctor. He still thinks that emergencies have a role in the medical system. Otherwise, for the prevention, treatment, and reversal of chronic disease, they have nothing. They have nothing. Every single time. I don't prescribe statin drugs. I have not, and I can. I still have a license to prescribe, believe it or not. I still have that. So I could, but I have not prescribed in about 12 years. And I never will again. I spoke last week in Austin, and we really try and limit our speaking engagements. We're not road warriors. We really we really pick our spots. And again, it's a privilege to be here with you guys. I was in Austin, Texas last week, and I was on the cardiology track for a very well-known lab testing company. The keynote speakers of the event were Peter Attia, Andrew Huberman. It was a very, very big event, beautiful event. And I'm the fourth cardiologist to speak. And the other three, they were just doing this dance of like, here's some natural stuff and here's some pharmaceuticals. And they're talking about low-dose statins, and they're talking about moderate-dose statins and time for high-dose statins. And then I come up, I'm the last one, and I just shred everything that they said. While one of the cardiologists, the guy who went before me, he's sitting like right here. And I'm looking at him as I'm just tearing up everything he says. And again, it's really hard for the doctors to get this. And again, that's why I made the comment about my wife and her intentions, with me, to get me to the good side. So, again, it's so difficult for these doctors to give up on that. I never prescribe statin drugs. Why? A, they don't work, okay? They don't work in the sense that they do not meaningfully lower your risk of heart attack, stroke, and dying. Sure, they reduce your numbers, but I can also say, why don't we just remove your liver, and that will also reduce your numbers. You would say that's crazy, but for some reason, swallowing a capsule is crazy. So they don't work. They have a litany, of course, of side effects. I believe that by the inhibition of the HMG-CoA reductase enzyme, and now downstream from that, you don't make cholesterol, you don't make CoQ10, you don't make something called dolicol that is in the substantia nigra of the midbrain where my father's Parkinson's-like illness is from. At least that's the anatomical location. The problem, of course, with him was too much bad, not enough good. So the other thing that statins interfere with reducing that enzyme capability is it makes it so you don't make a protein called heme A. And heme A is in cytochrome C oxidase, the fourth cytochrome in the electron transport chain. So now between that, first of all, you're missing the cholesterol in the mitochondria, you're missing the CoQ10 in the mitochondria, you're missing the heme A in the mitochondria. It's likely you're going to have problems from that. And is it possible that mainstream doesn't tell us all the side effects? Is it possible for the #1 selling drug of all time before the COVID scam, that Lipitor, #1 drug of all time? Okay? Marketing companies are the biggest marketing companies in the world. No one else is even close. No one else is even close. Okay, so I don't prescribe statin drugs for those reasons, and I believe that statins have killed millions of people. Now, why would someone say that? Wolfson, where are you getting that one from? Dementia, etc., all the different side effects, but they're killing people because it's a false sense of security. They think they could take a Lipitor, eat, live, and think however they want. But they're dying. It's not a matter of, oh, the evidence shows that if we take a Lipitor, it reduces my annual heart attack risk from 2% to 1.84%, according to a meta-analysis in the Journal of the American Medical Association 2022. Right? Anybody who wants my slides, I mean, I don't have a lot of, the studies that are on here and stuff like that, but I'm more than happy to share my slides, or if Lisa wants to. So that's not what it's about. We don't want to know how we lower our risk from here to here. We want to know, how do we get down to here? That's not what they do. That's what you all do every day. Every day. Now here's one other ditty. Is there anyone in the room, raise your hand, who likes the fact that their municipality adds fluoride to their water? Anybody? Come on, there's got to be one person who's like, oh, yes. Again, children are deficient in synthetic fluoride added to the water. That's why they develop cavities. It took all these years for us to develop that technology. Of course, the story behind it is so sinister and goes into the fertilizer industry, and ultimately it goes into the devil at work to control and destroy our brains. Get this. Those arrows point to a fluorine atom in those statin drugs, including Lipitor, atorvastatin, and rosuvastatin. There's fluoride in the atomic structure of that. Also SSRIs, Prozac, psych meds, a lot of pharmaceuticals. There's fluoride in there. I do not prescribe PCSK9 inhibitors. Some of you may have heard about this. This lecture was modified a little bit from my lecture that I gave last week in front of the cardiologist and a much more medical audience. These are the drugs like Repatha, the injectables that the people are on. And the data here on this stuff is absolutely miserable as well. There was a study called the Fourier trial that was produced. It was in the New England Journal of Medicine. Everybody in the trial was on statin drugs. Half the group got the injectable, half got placebo. The injectable group, their LDL went down to 30. Some gasps. Very low. And what they found was that over the course of the study, there was a 1.5% reduction in heart attack and strokes from the people who had the LDL of 30. 1.5%. It was like 11.3 to 9.8. But here's the kicker. More people died in the Repatha group. More people who had their LDL at 30 died. So congratulations, less heart attack, less stroke, more risk of dying. But ultimately, even with an LDL of 30, the course over 2 years, they had a 10% event rate. And if you talk to people and you say 1 out of 10 chance over the next 2 years, who wants to sign up for that? Nobody does. I don't. Okay. Because people say, okay, if you don't prescribe statins, then you prescribe this one here. I don't prescribe either one. Never have that one. Blood pressure drugs, the goal is to get people off of blood pressure drugs as soon as possible. When you see someone who is on them, and 100 million Americans are labeled with high blood pressure, when you see someone on them, the goal is to get them off them. Now I know you technically can't, right? You can't, you can't prescribe and you'll be in trouble with your board or whatever, Give them a wink, wink. I don't know, This is serious business. Why is it so important to get them off the blood pressure drugs? This is a study from the journal Hypertension, as sponsored by the American Heart Association. The fact this even saw the light of day, it's incredible. Absolutely incredible. Not too many cardiologists are talking about it, that's for sure. Okay, so what did this study show? This study looked at cardiovascular event risk. So they watched people for 14 years. And what they found is that the people on the green line were at the highest risk of having heart attack, stroke, and dying. The green line represents normal blood pressure on pharmaceuticals. The green line, therefore, is at higher than the red line, which is high blood pressure on drugs. So what they're saying is, if you're taking pharmaceuticals, it's better if your blood pressure is still high than if you're controlled. And then the orange line is high blood pressure, no drugs. Here's my point. You want to be at the blue line or below. That's the only safe zone. The blue line is the normal blood pressure, no drugs. So if you are out there and you're taking pharmaceuticals and your blood pressure is 120/80 and you're on drugs, and mine is 120/80 not on drugs, we're not the same. We're not the same. You have to get off of the pharmaceuticals, people. And there are people, oh, my cardiologist said this is going to make me better. I'm going to live longer. This is the answer. My blood pressure is under control. I'm good. No, you're not. You're going to die. You're part of the 76-year-old lifestyle for the men and 79 for the women. All the while, the last 15 years, you're in and out of the doctor's office and the pharmacy. I never order nuclear stress tests. I used to, because it was very lucrative. When I joined the big practice in Arizona, they sat me down and they said, we order nuclear stress tests on everybody. Every time you do it, it's $2,000 into the practice's pocket. Every time, $2,000. And they said, if you want to have a nice house, drive a nice car, go on fancy trips, right? You're going to do it. And if you're not, you can go back to Chicago. And I said, I don't want to go back to Chicago. It's cold there. That's why I'm here, you know? So I didn't think that it was a problem injecting nuclear material, radioactive material, into people's bodies. And not only that, your objective is to do it every single year. And then all of a sudden, the person has acute leukemia. And the family's like, how'd this happen? He was perfectly healthy. Okay, you can imagine how this talk goes over in front of other cardiologists, right? I never order coronary calcium scans, or as I like to call it, the calcium scam. You want to really swat the hornet's nest? Say this stuff on social media. Make this statement. People act like you are insulting their mother. Another quick tidbit, too. If you really want to stir up people, insult oatmeal. If you insult oatmeal, like top 5 things I would never eat as a cardiologist. Number 1, oatmeal. And they're like, what? What are you talking about? I've been eating oatmeal my entire life. I remember the Quaker Oats box on my counter. And yes, I had to add so many things to it to make it taste palatable. I'm adding different sugars and fruits and raisins and stuff. Don't insult my oatmeal. And they're like, oh, but oatmeal lowers cholesterol, right? And I'm like, if you want to lower your cholesterol, just eat the box. The box, right? The box is pure fiber. It binds up all the cholesterol in your gut. You poop it out. Okay. What was I talking about? Calcium scams. Okay, calcium scams. It is dangerous, useless radiation that does not change the plan, my plan. Because I'm not going to start someone on statins. I'm not going to start someone on injectables. I'm going to do the same thing I'm going to tell you about in just a couple of minutes of what my methodology is. Clearly is another super duper advanced CT angiogram. Oh, but it's okay, we're not going to use statins, but maybe it's going to motivate people. If people are not motivated by looking in the mirror, feeling lousy, seeing everybody else around them, and looking at the bad blood work, if that's not motivating enough, now that I was radiated, and now I'm going to take it seriously. That'll go nowhere. That argument is a total straw man argument. So I've never ordered the calcium scam, but again, you insult that kind of stuff? Seriously, because everybody's already had it done. Half of my consultations these days, I still do virtual consultations. I've been virtual since 2012. I've been very blessed, very, very thankful to not have to be in the hospital system all through the pandemic. I can imagine, going through that in the hospitals, and my wife saved me from that life. Forever, forever, forever grateful. No matter what she says to me sometimes, I can accept that because of what she has said in the past, what she saved me from. All right, so what do? I do order the most advanced lab testing in the world. I do order the most advanced lab testing in the world because unlike a CT scan, these things are changeable and they change quickly, minus the radiation. So what do? I do the mold mycotoxin panel, environmental toxin panel. I'm going to let my wife dive in a lot more into mold. And we've just been blessed with so many incredible stories. It's like, those of you who do speak and stuff, and Lisa would understand this too, it's like as you're up on stage and you have all these different stories coming in and you're like, you know, what should I tell, what should I not tell? And you know, you be around long enough, you got a lot of stories. It's good. Environmental toxin panels, metals, intracellular nutrients. Vitamin K2 keeps calcium in your bones and out of your arteries. Vitamin K2 keeps calcium in your bones and out of your arteries. So what is your intracellular level of K2? Oh, I take this K2, I do this, I do this. Okay, what are the levels? What are your levels of glutathione, CoQ10, omega-3 fatty acids? So this is really phenomenal testing that you can do. I know states are different and stuff like that, so I shouldn't speak in total generalities, but let's say your people can get it done. And the medical doctors are not doing this. They seriously think Lipitor should go in the drinking water. They don't even care what your numbers are. Just take the max dose of everything. The wheat zoomer is the leaky gut analysis. When I first met my wife, the woman who would become my wife at the end of 2004, she starts talking about leaky gut. I said, where'd you come up with that crazy chiropractic diagnosis? I never heard of such a thing. And she said, go read about it, smart guy. So I went to go read about it. There wasn't much in the medical literature. But over the last 10 to 15 years, the concept of leaky gut intestinal hyperpermeability, it has exploded in the medical literature all over the place. And now we have the ability to test people for it and show them and say, congratulations, you have a leaky gut. I mean, she was making these comments like, oh, it's about the gut, about the gut, about the gut. I'm like, what do you mean about the gut? I'm a cardiologist. I'm a heart doctor. What does that have to do with the gut? You see how stupid we are? Isn't that crazy? The head of neurology at the Mayo Clinic has no idea. The 29-year-old chiropractor just blows it up. Blows it up. Advanced cardiovascular analysis, you know, so all those things, you know, hormones and markers of inflammation, oxidative stress. If you want to know one marker, I think that really would be the most cost-effective and maybe the most important. And this is all debatable, and I don't want Jabin like debating me on this, but it is the markers of inflammation. Inflammation or oxidative stress, that just tells you your body is on fire, you're in trouble, and you better fix the root cause. All cardiologists know inflammation, oxidative stress are bad. They just use statin drugs and other pharmaceuticals to deal with it. They know nothing about root cause. Gut zoomer is, again, looking at your gut microbiome. All right. This is a slide that I made, 14 ways mold mycotoxins impact the cardiovascular system. 14 different ways. It's a lot of ways. A lot of ways. If your people are not getting better, if you do not feel optimal, again, I will let my wife hammer this one home, but we can't say it enough. Think about water damage in your home. Can we measure people's plastic levels? This is the journal, the New England Journal of Medicine. This is from 18 months ago, where they looked at people who were undergoing a carotid endarterectomy. So they had plaque in their carotid artery, they had surgery, the plaque was removed, and then they looked under a microscope. And what they found is that 2/3 of the people had evidence of microplastics under a microscope. 1/3 of the people, surprisingly, didn't. The group that did have the microplastics had triple the risk of heart attack, stroke, and dying over the next 3.5 years, which makes plastic a bigger risk factor than smoking, drinking, high blood pressure, diabetes, obesity, combined ×2. Plastic is really, really, really bad. When we check people's levels of bisphenol A, trying to get them to understand, they're, oh, I'm in the green zone. I'm happy you're in the green zone, but do you know that the normal level of bisphenol A is 0.00? That's the normal level. And plastic, as you all know, is everywhere. People walking around plastic clothing, nylon, polyester, rayon. In case you care, but you don't, I'm wearing organic cotton underwear, okay? We take the lifestyle very, very seriously. And believe me, anything that I'm saying up here for the millionth time, I owe it all to the woman who's coming up next. Every bit of it. If it wasn't for her, I'd be totally toast. Toast. Okay, so mainstream, so a lot of people are getting on this. Test your patients, do they have bisphenol A? And then show them, hey, this is my strategy to reduce those levels. Glyphosate linked to a 265% increased risk in heart attack. Glyphosate, really, really, really bad, obviously. Normal level of glyphosate, 0.00. Before Monsanto invented it, levels, it didn't exist. Didn't exist. And we could do an hour lecture on the ravaging effects of glyphosate. This is what I call the heart attack path. So toxins damage the gut microbiome. That leads to leaky gut, intestinal hyperpermeability. That leads to markers like inflammation, oxidative stress, immune system activation. Your immune system kicks in and says, what are these poisons? And it goes into attack mode, leading to the inflammatory mediators, leading to the excess oxidative stress where your body is literally rusting. That leads to things like blood vessel dysfunction, endothelial dysfunction. The lining of the blood vessels, they don't work. Autonomic dysfunction, you get Grandpa David passing out. Autonomics. All these people are on POTS syndrome, mast cell activation, all these dysautonomias. Didn't used to be that way. And then ultimately you get plaque formation, coronary artery disease, heart attack, stroke, dead. There's no genetics in that sequence. There's no, we forgot Lipitor, Crestor, Zocor, stents, or bypass surgeries. So many people, they have the coronary calcium scam. The reason why you have to pay for it in cash is because insurance knows it's a dangerous test that is worthless, because it's what's called a cascade test, where one test begets another. Now you do a nuclear stress test, so now you're radiated twice. Little bit abnormal there. That little bit of abnormality, cardiologist says, let's do an angiogram to be sure. Angiogram happens, well, you know, there was, a 70% blockage. Just to be safe, I put in a stent. It may save your life. Lies. Lies. According to the ischemia trial and the courage trial, major trials, stents are for symptoms. They don't save lives, and they don't prevent heart attacks. They have a small benefit in the case of if you're having a heart attack. They will have value in that scenario. But for these people, like, oh, I had a scan, it led to this, and my life was saved, I had the Widowmaker. Lies. Not true, according to 2 major trials. All right, so this is my company, Natural Heart Doctor, prevent, treat, and reverse cardiovascular disease while eliminating dangerous pharmaceuticals and surgeries. This is our 100-year heart method, Thrival Nutrition, Thrival Lifestyle, which includes chiropractic. Lifestyle, of course, is sleep, sunshine, physical activity, chiropractic, holistic dentistry, and avoiding all the toxins. Too much bad stuff, not enough good stuff. My favorite food on the Thrival Nutrition is seafood. Seafood is the healthiest food. You can believe whatever you want. All the literature says people with the highest levels of omega-3 naturally lowest risk of everything. Wild salmon, sardines, anchovies, clams, oyster, shrimp, lobster, crab, and wild salmon roe. The fish eggs, everything a salmon needs to come to life inside of those eggs. And they're all intertwined. They're all together. It's not one's more important than the other. Whenever I talk to someone and they had a heart attack, they had a stroke, there's always stress that preceded it. Always stress. Now, and there's actually 2 diagnoses in women. One's called Takotsubo cardiomyopathy. The other's called SCAD, spontaneous coronary artery dissection. Stress in women leads to those. Medical diagnoses, not like debatable. Every cardiologist is familiar with those. Now, along with that is the Thrival Ultra Diagnostics, doing the most advanced testing in the world. And again, the techniques that you all use, and quantum nutrition and AK and muscle testing, you know, it was very easy to be a conventional cardiologist. Hi, how are you? Your cholesterol's high, take this pill. Your blood pressure's high, take this. Bye, get a stress test on your way out. Did you just see that? That's what I just did. I mean, that was the consult. And then now you get into the world of natural, and someone's like, oh, what about this? And I'm like, there's literally 20,000 things we could all be doing right now, okay? This is, you know, for example, like one of our blood pressure protocols. We got some foundational stuff there, like, you know, and my wife will talk about these more, about some of the products that she has that are similar. But it's really about using a food first and even food supplements first mentality is what we do. Walk the talk. Get on the social media, get at the Thanksgiving dinner, and keep blowing people up with the truth. Because that is the only way you're going to help them. That is the only way that we're going to change the world and make the world a healthier place for us, our children, and our children's children. So with that, I'll leave you with a thank you.